Cleaning or supporting your liver naturally involves lifestyle choices and dietary habits that promote liver health. Here are some effective natural methods to support your liver. Number 1. Stay hydrated. Drink water. Aim to drink at least 8 glasses of water a day to help your liver flush out toxins. Number 2. Eat a balanced diet. Fruits and vegetables. Include plenty of fresh fruits and vegetables, especially leafy greens, citrus fruits, and cruciferous vegetables like broccoli and Brussels sprouts. Whole grains. Opt for whole grains like brown rice, oats, and quinoa over refined grains. Lean proteins. Include sources of lean protein like chicken, fish, beans, and legumes. 3. Incorporate liver-friendly foods. Garlic contains compounds that activate liver enzymes that help flush out toxins. Beets and carrots, high in plant flavonoids and beta-carotene, they help stimulate and improve overall liver function. Green tea, rich in antioxidants that help improve liver function. Avocados help the body produce glutathione, which is essential for liver cleansing. Turmeric contains curcumin, which assists in detoxifying the liver and has anti-inflammatory properties. Lemon. Drinking lemon water can stimulate liver function and aid in detoxification. Number 4. Avoid toxins. Limit alcohol. Excessive alcohol consumption can damage liver cells. Avoid processed foods. Reduce intake of processed foods, sugars, and unhealthy fats. Be cautious with medications. Only use medications as prescribed and avoid over-the-counter drugs that can harm the liver, like excessive acetaminophen. Number 5. Exercise regularly. Physical activity. Regular exercise helps reduce liver fat and improves liver function. Aim for at least 30 minutes of moderate exercise most days of the week. Number 6. Maintain a healthy weight. Weight management. Excess weight, especially around the abdomen, can contribute to non-alcoholic fatty liver disease. A healthy diet and regular exercise can help maintain an ideal weight. Remember, it's always best to consult with a healthcare professional before making significant changes to your diet or lifestyle, especially if you have existing health conditions.